Good evening and welcome to Public Access Television Channel 18's Live and Local. My name is Scott Gill and my good friend here is Keith Ruff. We are with Access to Independence, your local center for independent living. We are a center that is governed by and staffed by persons with disabilities. It's our mission. It's our goal to assist those in need of becoming more independent or of maintaining their level of independence, those persons with disabilities and those individuals going through the aging process. This evening we're bringing to you a show that will focus on healthcare and hopefully provide information to you on how to better communicate with your healthcare provider, your doctor, your dentist, your nurse, your personal assistant, and how to work together to create a team approach for healthcare. If you have any questions regarding this evening's show, you can always call Keith or myself or Abbey at our center, and the telephone number is 319-338-3870. So, without further ado, I would like to turn the time over to your co-host for the Live and Local show, Mr. Keith Ruff and Miss Abbey Almelien.
Thank you, Scott. Abbey and I will be looking forward to your question on this most important health topic with the pre-existing condition. Should they be covered or not? Please call the number at the bottom of the screen if you feel you have questions for us. Thank you.
Good evening and welcome to the show this evening, which we are calling Becoming a Medical Team Player. And we're going to discuss specifically people with disabilities in the medical system. I'm Abbey Almelien, a co-host for this evening's show, and along with Keith Ruff, we have a couple guests, and we're going in that are healthcare providers, and we're going to get their take on a few issues also. We're going to start right now, though, first with a brief PowerPoint presentation with some slides talking about becoming a medical team player. So the first slide shows just a group of people that you might see in a clinic or a hospital, and they all have nice, friendly smiles on their faces, but they also have those scary white coats and scrubs, and they look all official and everything. And while this can be daunting to any individual, and including people with disabilities, we like to think of it as a whole team with the patient or individual as being the head of the team or the coach or the boss, and everyone working together. The first tip is entitled Listen to Your Body, and that means that the patient needs to be responsible for noticing symptoms and reporting them. Nobody knows better than the patient themselves a change in what's normal or something that is bothering them, and so it's important for them to be in touch and have frequent communication. Also, along with this is doing what you can to be responsible as far as eating well, exercising, and just taking care of your body at the best that you can. The second point says, understand that every medical person is a person. She has a family and a job. She even sometimes gets sick herself. And so not thinking of the doctor or other care provider as somebody that is just in that official position, but realizing that you can talk to them on a personal level also, and as much information as a great resource that they are, they also might not be able to answer every single question perfectly, because they are a person that can possibly make mistakes too. So you should do what you can to learn about your condition, and whether that's on the internet or through books or articles, but just doing what you can to educate yourself about everything from your diagnosis to possible treatments. And it's great to bring that to your provider and say, I heard about this, what do you know about that? And discuss. All this is, like I said, being a discussion back and forth. So taking control a little bit about what you know about your disease or condition. Next is about writing questions in a special notebook, because it can be intimidating to be sitting in the office, and it might escape your mind for the moment what you were wondering about. So as these questions come to you, you can just jot them down, bring them in, and go through them point by point. And then you can write the answers in the book, but just trying to stay organized with everything also. It's important to tell the medical staff how you feel, because nobody knows what causes pain exactly. They can anticipate, but if you have a certain position that is uncomfortable, you need to let them know. Don't just try to fight it or anything. It says here, if a procedure hurts, yell out, let them know. Or if a new piece of equipment doesn't fit, say something then too. Also, you can consider another team member if your questions are not answered. That's why it's important to think of this whole system as a team. Possibly where one person is more specialized, another lacks certain information. If one person doesn't know exactly about how this payment is going to be covered, they can hopefully redirect you to a social worker, for instance, that might be more specialized in that area. Also, it's okay to shop for another doctor if needed, meaning getting a second opinion, a third opinion, anything like that. Sometimes a different institution, or sometimes within the same institution. Doctors and other medical professionals should not be offended by this, and if they are, then you'll have to wonder what the problem is, and it's okay to get more than one opinion on a condition. Also, it's important to cooperate, and this is about being compliant with, because you are the boss, but you're also a very active team player also. So taking your medications as prescribed, and also following other instructions of the team that you have chosen. This one showing a person exercising or following a special diet if that's what it is, but doing everything you can to participate. The next one says, think of your visit as a timeout. And here the picture is of some people enjoying some ice cream. And so the idea here is that sometimes it can be cause a lot of anxiety to go into the doctor for a visit, but if you can just treat yourself to something nice afterward and kind of decompress and discuss it with another team member who might be a support system with you, then that can kind of help you digest everything that you've been through. And the last one says, use your visit as a chance to make a connection with another person. This shows people using sign language that possibly are deaf or hard of hearing. And you might run into somebody in a clinic or a hospital that has a condition such as yours, and they might be a new resource to you of other options or things like that, or possibly even just a personal friendly connection to make too. All in all, just remembering that you're the leader of this team, but you all have a common goal, and that is that you're all aiming for the best treatment of you. So now we're going to open it up for discussion, and I'd like to introduce our guests for the evening. Here we have Max Sterling, and I'll let him introduce himself.
I'm a second-year physician assistant student at the University of Iowa,
And you also have a little work experience in another medical setting?
Yeah, before I came back